individuals who are Medicaid recipients will at some point have to go in and either reapply, be recertified, be verified, re-verified. We just don't know what that's going to look like. It has been done in a couple other states where it failed because in rural health, limitations on the internet, limitations to administrative support, and or transportation to the office that would help you with this has been the biggest barrier. Patients will fall through the cracks. And Blue Ridge's position is we will help every patient we can, but again, until we know how it works, we don't know what to expect. Patients who don't know what to expect. Individuals who are adult and children, they don't know what to expect. So there's still a lot of unknowns of how we're going to manage this.
How we can distinguish between our partners at the Blue Ridge Medical Center and what we do in public health. Operate in the state, we receive significant funding from the federal government through grants. And so some of the things that we're looking at under the umbrella of the role of public health here in Nelson is what is the bill going to do in terms of our operations, the funding that we're going to receive or not receive when it comes to the delivery of our service. Science and art of preventing disease, prolonging life, promoting health through the organized efforts and informed choices of society, organizations, public and private communities, and individuals. And what I take from that is there's a lot of people that covers. There's a lot of organizations, a lot of individuals. And so public health, in my mind, is a team sport. It's partnerships between Blue Ridge Health District and the Blue Ridge Medical Center, to community organizations, local government, activists in the community who are really trying to fight for the health of individuals in our community.
So link down here if you want to know more VA and the great things that VA does for our veterans. Severe staffing shortages, this is happening right now. Also delaying and denying education benefits called the GI Bill. You know, you serve a certain number of years, you get some money to go to college, pay tuition, get money for books and whatnot. Well, there's now delays and denials in payment of GI Bill education benefits, and veterans are now starting to drop out of college because if there's any delay in receiving the money, they can't afford to go. VA medical care and staff, cut claims and benefits, privatize VA, close VA, and eventually sell off the properties. If you've been likely that already stressed private sector healthcare facilities could address the complex needs of veteran patients.